For the woman who feels her breast size is too small or not properly contoured, cosmetic breast enhancement can be the answer. With years of experience, Dr. Sanders is well known for his excellence in aesthetic breast surgery.
Breast augmentation is a procedure with many, many options. We have options of what size of implant, what is the implant filled with, whether it be silicone or saline. We have choices as to the shape of the implant, of the surface of the implant, and then there are always the choices about incisions, whether it be underarm, under breast, through the areola, or through the belly button. Whenever I speak to a patient about breast augmentation, I like to review the options and allow them to make a decision based upon the facts. I'm happy to advise them, but again, it's ultimately their decision. But most of our patients do decide to have an implant placed behind the muscle. That's because the implants stay softer behind the muscle, they also tend to ripple less, and mammograms are better. Now when we go behind the muscle, the more traditional way of doing things is to put the implant completely behind the muscle. The problem with that technique is that if a woman has had children, the breast is going to be drooping, but yet the muscle is holding the implant up. So you almost get sort of a double bubble look, which doesn't look particularly good. And with that technique, where you're completely behind the muscle, there's also a fair amount of pain. And when you flex your muscles, as in working out at the gym, you're going to see those implants bounce up and down, which looks a little bit odd. So most of our patients choose the 80-20 procedure, where the implant is covered in its upper 80% by muscle, but in the lower 20%, the muscle is behind the implant. That works great because if the breast is drooping, the implant can settle with it, so you don't have a double bubble look. Also, it's far less uncomfortable, and when you're flexing the muscle at the gym, you're not seeing that implant bouncing up and down. So with that 80-20 technique, we're really able to make a great deal of difference in terms of discomfort as well as a very natural look. Whenever we do place the implants in the patient, we will also need to do an uplift in certain cases. Again, the uplifts can be done in a variety of ways. If you have a great deal of uplifting that needs to be done, the incisions tend to be longer. But for many of our patients, we're able to do the uplift with just a small incision around the areola, which tends to heal with a scar that's very, very difficult to detect. The other important thing with breast implants that we really focus on is minimizing the chance of firmness after surgery. When we put the implant in, scar tissue develops around it, which is okay. But if that scar tissue begins to contract and squeeze down, the implant can look very, very unusual, perhaps like two half grapefruits on the woman's chest, which we obviously don't want. So what we do to help prevent that is, number one, we go behind the muscle. Number two, we have the patient doing some massage exercises for a few months afterwards. And the third thing we do to try to keep things soft is that whenever we place the implant inside the patient, in the operating room we actually put a sheet of sterile plastic over the breast. We make a small incision through it, slip the implant in so it never touches the skin as it goes in. In that way we avoid any bacterial contamination of the implant that's carried into the pocket, which can lead to the scar tissue contracture. So with some of these things that we're doing nowadays, we're getting the very finest results that I've ever seen with breast augmentation. I've had a chance to do about 2,500 augmentations as well as a number, perhaps several thousand, of redo procedures. And with the current state of the technology, there is no better time to have a breast augmentation than right now.
In addition, Dr. Sanders can remedy excessive development of male breasts through a procedure to treat gynecomastia.
I had a breast augmentation surgery done, and I also had liposuction done. And the reason I had the liposuction done, it was on the back of my legs, is because that was just a stubborn, fatty area that I had had since I was a teenager. And no amount of dieting or exercising had any result with getting rid of that area. I had the breast augmentation done because I have 2 young children, and pregnancy can wreak havoc on your figure, and I wanted to have a little bit of an enhancement and make sure that my figure was up to snuff and something I was happy with. I had surgery with Dr. Sanders in November, and the surgery went really, really well.
I was very satisfied with the size of my breasts for many years, but I did want them to be a little bit larger. After having a procedure of my eyes and my forehead with Dr. Sanders and feeling so comfortable with him and the whole staff, even though I was nervous about it, I decided it was something I really wanted to do. And so I consulted with Dr. Sanders, we agreed on the size, and I felt very confident in what was going to happen. And since having it done, I am so happy.
The other thing I decided I wanted to do was fix the top. I didn't want to put implants in and make them bigger, but I just needed a little lift, which I got, and I'm thrilled with the way I look at my clothes now.
As of 4 weeks ago, Dr. Sanders removed the gynecomastia out of my chest, allowing me to feel free, confident, someone would say even sexy. Dr. Sanders is the best doctor as far as I'm concerned. He's had an excellent staff, clean crew, very confident, very prompt.
The results that I have had have just absolutely been fantastic.